Hello, nurses. Today we will be talking about depression. Depression is a mood disturbance characterized by exaggerated feelings of sadness, despair, lower self-esteem, loss of interest in formal activities, and pessimistic thoughts. It's more than a state of mind. It is an illness that affects about 1 in 10 people every year. It's found in all races, ethnic groups, and socioeconomic levels. Women are affected twice as men. A client who has depression has a potential risk for suicide, especially if he has a family or personal history of suicide attempts. Family history and a personal history of depression are the most significant risk factors. Depression is very common among clients older than age 65, but the disorder is more difficult to recognize in the older adult client and can go untreated. It is important to differentiate between early dementia and depression. Some clinical findings of depression that can look like dementia are memory loss, confusion, and behavioral problems such as social isolation or agitation. Other risk factors are neurotransmitter deficiencies, serotonin deficiency, which affects mood, sexual behavior, sleep cycles, hunger, and pain perception, norepinephrine deficiency, which affects attention and behavior. Subjective data. Anergia, as a chunk and without ergia, energy, without energy or lack of energy. Anhedonia, as a chunk and without hedonia, pleasure or cheerfulness, which mean lack of pleasure in normal activities. Anxiety, a state of excessive uneasiness and apprehension. Vegetative findings, which include a change in eating patterns, change in bowel habits, sleep disturbances, and decreased interest in sexual activity. Objective data physical findings. The client looks sad with blunted affect, exhibits poor grooming and lack of hygiene, slow physical movement, slant posture, restlessness, pacing, finger tapping, showing little or no effort to interact, delayed response. The client can seem too tired even to speak. Depression is usually treated with medications, psychotherapy, or a combination of the two. If these treatments do not reduce symptoms, electroconvulsive therapy and other brain stimulation therapies may be options to explore. Antidepressants may help improve the way your brain uses certain chemicals that control mood or stress. Usually takes 2 to 4 weeks to work, and often symptoms such as sleep, appetite, and concentration problems improve before mood lifts. So it is important to continue taking the medication. Duloxetine or Cymbalta. This works as a dual inhibition of CNS presynaptic neuronal uptake of serotonin and norepinephrine, thus increasing the serum levels of both substances. Educate patients to report emergence of any of the following: anxiety, agitation, panic attacks, insomnia, irritability, hostility, psychomotor restlessness. Monitor blood pressure, especially in those being treated for hypertension. Antidepressant drug therapy, citalopram or Celexa. This medication works by inhibiting of CNS presynaptic neuronal uptake of serotonin, which results in antidepressant. Citalopram or Celexa nursing implications. Monitor for adverse effects can include nausea, headache, and CNS stimulation such as agitation, insomnia, and anxiety. Educate patients that sexual dysfunction can occur and notify provider if effects are intolerable. Psychotherapy by a trained therapist can include individual cognitive behavioral therapy, interpersonal therapy, group therapy, and family therapy. Cognitive behavioral therapy assists the client to identify and change negative behavior and thought patterns. If medications do not reduce the symptoms of depression, electroconvulsive therapy may be an option to explore. Electroconvulsive therapy can be an effective treatment for depression in some severe cases where a rapid response is necessary or medications cannot be used safely.
created using Powtoon.